Hey guys, Dr. Cratio here, chiropractor from London, Ontario, Canada, helping people regain their health through the power of structural chiropractic care and life by design principles. And on today's video, are structural problems causing or contributing to your headaches? So what does that even mean? Is poor structure causing my headaches? First thing we need to understand clinically about headaches, I mean, as a patient coming in to see me or coming in to see a clinician, headaches are very complicated. There can be multiple causes. So something as simple as dehydration, which by the way is the most common cause of daily headaches, or on the flip side, something very complex and very ominous like a brain tumor, and anywhere in between can cause or contribute to your headaches. What I'm suggesting and what we've seen clinically is when the structures of your neck, so when you think of the anatomy of your neck, you think of the bones and the ligaments and the tendons. If there's structural damage that's starting to occur in your neck, it can be the cause in some cases, or it can be part of the kind of plethora of causes that are giving you headaches. Now, the purpose of this video is to draw your attention to the structural causes that we would look for here in the practice and in the clinic, but also to give you some ways to test for yourself. Now, I'm gonna be talking about 5. Not all 5 of these need to be present, because typically what happens is one of them will show up first, and then because the damage doesn't get better on its own, it continues to get worse and worse. So eventually all 5 of these will show up. I'm gonna spend now, you're probably gonna be wondering, well, what can I do, right? If you go through these exercises and if you're like, I'm curious about this, what can I do? The first thing you can do is you can get an examination to see to see which of these other things are happening. So you would go to somebody who knows what they're looking for. If you're local, if you're in London, we'd love to help. If not, send me a message. I can probably find somebody that will be able to help you. But the other thing I'm gonna be including at the end is I'm gonna include a link to exercises that I'm hoping will help you. All right, so without further ado, let's get started. All right, number 1, decreased, I wanna make sure I'm saying it right, decreased or unbalanced range of motion. So we're looking at neck range of motion. You should be able to, there's normal ranges of motion. So I should be able to turn my head 90 degrees this way, should be able to turn it 90 degrees this way. If I laterally flex, try to touch my ear to my shoulder, should be 45 degrees this way, should be able to look all the way up, and I should be able to touch my chin to my chest. Now, if you can't necessarily feel it, it might be beneficial to work with a partner, but what I want you to do is I just want you to test the range of motion. One of the things that you'll probably notice is that you can turn your head easier from one side to the other side. Right? Maybe you won't be able to get your head to 45 degrees, but my point is test it to see if there is an imbalanced range of motion or if there's a decreased range of motion. Maybe you can only turn your head to here on both sides. Now, just because it's even on both sides doesn't mean that it's within the normal limits. It means that it's limited on both sides. You should also be able to do this pain-free. If it's painful to do it, that's another positive sign. So again, unbalanced or decreased range of motion is a potential sign that you have damaged structure in your neck. Number 2, swelling or inflammation. So what's going to pop up on the screen right now is a tool that we use in our office called thermography. So thermography, or your thermographic image, is a very sensitive thermometer that measures skin temperature between the left-hand side of your spine and the right-hand side of your spine. And what you're going to see on the left side, this is the same patient, this is a migraine sufferer that has come into our office. The ones on the left are the pre-check, and the ones on the left are her initials, and the ones on the right are after she completed her first program of care. And what you're gonna see on the left is you're gonna see there's black and red bars. I want you to look specifically at the top, which is the neck. What we're measuring, you can see where the black and red bars are. Those are large temperature differences that if we look at the newer ones, they're still large temperature differences. However, because the structure, we were able to positively benefit the structure of her spine. You can see that the larger bars are starting to shrink, so her body's becoming more into harmony. This is also an examination that measures the autonomic nerve system, or the system of nerves that control your organs and your glands. But it's definitely a sign. If there is damage to the structure, one of the ways that your body deals with damage is it sends inflammation to that area. The inflammation brings white blood cells and red blood cells and platelets, and it's an attempt for your body to heal that area. But if we can run an examination to see if there's excess swelling and excess heat coming from that area, it's a sign that there could be structural damage there. Number 3, loss of curve or spinal degeneration. So what's gonna pop up on the screen right now are 2 sets of x-rays. The one on the left is a normal film, and the one on the right, again, this is a young kid, 16-year-old boy that came in with migraine headaches and a history of concussions. Now there's going to be arrows on the x-ray of the actual patient, and I wanted you to see what a normal x-ray looks like compared to one with somebody who has actually suffered structural damage and who is dealing with not just post-concussion symptoms, but also headaches as well. So the first arrow is pointed at the very, very top bone of the spine, called the atlas. Now you can see that his atlas is slanted downwards, and what we want to see, that in our profession is called a negative atlas angle. We want to see an atlas angle that is slightly, I didn't draw the lines, but I want it to be slightly above horizontal. That's a normal atlas position. You can see that the back of it is really, really close to the skull, excessively close. And then what you're gonna notice, the normal x-ray has a C-shaped curve that is about 40 degrees. That's a normal curve shape, but you can see that it's developing an S-like pattern, and at the very, very top at C1, 2, and 3, it is reversed. So instead of having that nice C shape, it's actually going C shape in the opposite direction. And the third arrow, and this is another sign that we'll see, it's not really happening with him, it's really, really slight, but eventually if that poor curvature continues, the discs will start to wear, and there's bone spurs or degeneration that will start to happen in the discs. We don't really see it with him, maybe slightly starting to develop, but it's debatable. But those are the signs that the typically curve loss happens first, negative atlas angle, curve loss, and then degeneration, bone spurring, arthritis, stenosis, and things start to close off. I wanted you to see what that looks like early versus late. There's lots of evidence of late. It's harder to capture one of those moments early on. Number 4, hypertonic or irregular muscle pattern. Again, on the bottom right now, I'm going to show you. This is the same patient from before, the migraine sufferer. The one on the left is the very first one that we did, and the one on the right is the one after her first program of care. What I want you to notice, we're measuring muscle activity. I want you to notice on the first one, there's just a wall of red that sprouts up, looks like it's from the middle of her neck all the way up. There's this wall of red. And on the second one, you can start to see there's still a lot of red. It's still extremely tight, but you can see the areas where the muscles are starting to fire better. What happens when there is structural damage is your muscles engage, because the muscles are tight, not because there's reasons why tight muscles could be a bad thing, but typically, here's something to think about. Typically, the muscles become tight to stabilize the area because it's damaged, or they don't pull. And I've heard people say this all the time. The muscles pull things out of alignment. Your body's not at war with yourself. The muscles are trying to hold things together and pull things back into alignment. But when we measure the muscles, we have evidence that they are tight, that they are overworked. You can probably even feel them on yourself if you have a great massage therapist, or if you go see a massage therapist. When they start digging into these muscles in the top part of your spine, it could hurt a lot. It could also feel really good, because when she loosens them up, it gives them a little bit of a break, and that provides relief sometimes. But they're tight because they're trying to do their job. When there's, like I said, when there's structural damage, the muscles will turn on, they will try to make things better, and eventually if things don't get better on their own, they will become tired and overworked. But that is a sign that something is happening up there. And last but not least, an increase in stress. And I don't necessarily mean negative stress, right? It could just be you're busy, you're asking more of your body, you've done something different, but an increase in stress typically makes the headache worse. Now, why is that a sign? So stress is one of those things that it's like poisoning the soil or making the soil worse. It's an insidious thing that negatively impacts everything in your life because it undermines your body's ability to fight things off. If there's damage to the structure of your neck, that becomes a very high priority to your body. It requires a lot of attention, and your body tries its best to try to correct those underlying problems. Now, the challenge with that is when you experience stress, it'll tend to go here simply because that area is weak. So if you find yourself saying, I had a stressful day and now I have a headache, or I have a stressful day and now I have neck pain, or I've been busier today than typical and now this is happening, or I did something new, it's a potential sign that you have structural damage in your neck. Okay guys, so that's it for the video. If you have any comments or questions, please post them below. I would love to answer them. I would love to help if I can. Also, up here is where the video to the migraine exercises is going to pop up. So feel free to watch it. It will hopefully, fingers crossed, start to give you help right now. Like I said, I'm here. If you have any questions, would love to help. Have a great day. Thanks for watching.